Welcome to Mindfulness-Based Cognitive Therapy for Chronic Pain. We're glad you're here. My name is Angie Hunt, Project Manager with the Work, Wellness, and Disability Prevention Institute, and I'll be moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC Government, as well as donations and memberships to WWDPI. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing, as well as to ask any questions you have related to the presentation. We'll collect questions submitted throughout the presentation and follow the presentation with a Q&A based on the questions submitted. Following the webinar, any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website within a week, along with the slides. You'll be emailed the direct links for all of these items when they're available. As I mentioned, my name is Angie, and I'll be moderating the webinar and Q&A session. Our presenter today is Melissa Day. Dr. Melissa Day completed her MA and PhD at the University of Alabama, followed by her clinical psychology residency at the University of Washington. Dr. Day then undertook a postdoctoral research fellowship in pain psychology, also at the University of Washington. She is now an endorsed clinical psychologist in Australia and most recently was awarded a National and Medical Research Council Research Fellowship, which she is completing within the School of Psychology at the University of Queensland. Dr. Day's program of research has focused on implementing randomized controlled trials to evaluate the efficacy and mechanisms of cognitive behavioral and mindfulness-based interventions for chronic pain conditions. She recently published a sole-authored book with Wiley titled Mindfulness-Based Cognitive Therapy for Chronic Pain, a clinical manual and guide. And now I'll hand it over to Melissa.
Okay, thanks Angie for that introduction. So as Angie said, today I'll be describing an innovative approach to psychological treatment for pain called mindfulness-based cognitive therapy. And while directly this relates to pain, much of the concept and practice of mindfulness also applies to us as professionals, as the importance of self-care cannot be overstated. Stress and burnout is high, and so I hope that today you'll learn something to not only help your patients, if that's your profession, but also to improve your own self-care as well. And so just to go over our basic objectives for today. So I'll provide a brief background on chronic pain, describe the basics of MBCT theory, describe a little bit about how you can use mindfulness self-care for self-care to prevent burnout, and also provide you with some resources to further explore that if it's of interest to you. We'll also go over how to administer group-based MBCT for pain, so go over the basics of that. And I'll summarize the research on the effects and mechanisms of MBCT for pain. So in terms of a brief background on chronic pain, it's a major public health care concern affecting 3.2 million Australians. Similar statistics elsewhere. So in America, chronic pain effects are reported 205 million with severe headache, back pain, neck pain, or face pain. And worldwide, lifetime prevalence rates exceed 35% as well. Low back pain and headache are the most common pain types, but it's likely that all of these statistics are underestimates, as chronic pain is also underdiagnosed and undertreated as well. And so it costs $34.4 billion annually. That's here in Australia, so quite an expensive and significant problem. So the most common treatment for chronic pain is opioids, and in the US, the prescription of opioids and the misuse has been termed a healthcare crisis. Between 1999 and 2010, there was a 300% increase in opioid consumption, and death rates for opioid poisoning tripled, so more than 16,000 opioid-involved overdose deaths in 2010. And so psychosocial treatments, on the other hand, have been shown to be as effective as surgery and medication management for chronic pain. And within this, cognitive behavioral therapy is considered the first-line treatment option. So there's a large body of research supporting the efficacy of CBT. And it's really considered the gold standard treatment approach at the present. But within that, there has been an upsurge of interest in mindfulness-based approaches, and the evidence for these interventions is rapidly increasing. And just as we have multiple forms of antidepressants, SSRIs on the market to attempt to find the one class that is best suited to a particular individual, so too do we really need a variety of evidence-based psychosocial treatments that are available for individuals to help manage their chronic pain. So switching gears then to focus on the theoretical rationale for why we would apply MBCT for pain. Really the goal here, or the aim, is not freedom, freedom from the pain per se, but freedom from the extra baggage that can get piled up on top of the pain. So in the form of negative thoughts, judgments about the pain, emotional responses such as depression, anxiety, anger, and also unhelpful behaviors that often come along with a chronic pain problem. And so the approach is one of non-striving, and so participants or patients that complete MBCT are asked to set aside any goals or expectations that they may have coming into the program, as these, in a sense, set limits and parameters around what might happen. And so instead, the approach with the program is to bring an open curiosity to what might unfold. And so within that, non-judgmental attitude is emphasized, along with a sense of kindness towards oneself. And so why MBCT? Why not just cognitive behavioral therapy? Well, the integration, the inclusion of the cognitive exercises, these facilitate awareness of stressful as well as pleasant events in an individual's life. They also help facilitate awareness of patterns of automatic thoughts. So things like catastrophizing, black and white thinking, minimizing, that type of those categories of automatic thoughts. Also helps facilitate the idea that thoughts are not fact, which is not our typical approach to viewing our thoughts. Usually we go along with them as if they are the truth. And so the cognitive exercises in MBCT sort of allow you to take that step back and just see thinking as thinking. And also the awareness of nourishing and depleting activities, which I will tell you more about later in today's session as well. And so concurrently, the mindfulness meditation exercises, the practice facilitates awareness of the nature of thoughts, emotions, and sensations, really learning how to respond versus react automatically and habitually. And also the meditation practice really results in a decreased stress response as well. And so you might be wondering, how does this apply to my own self-care? So before I get into the more of the excuse me, details of the protocol, just wanted to orient you to thinking about how you can use these skills not only to teach to the patients that you might work with, but also as a way to optimize your own physical and mental functioning so that you can perform at your best, whatever it is that you do. And so burnout is quite common among therapists, and when I say burnout, this has been defined as a syndrome consisting of emotional exhaustion, depersonalization, and really a reduced sense of personal accomplishment as well. And so rates have been shown to be between 25 to 60%, all the way up to 75% in one study. And so burnout often leads to or is associated with depression, anxiety, low mental quality of life, and also, unfortunately, high career turnover. And so prevention really is better than the cure. And so starting with that, really self-awareness is the key to optimal function. Self-awareness has really been found to be the foundation for monitoring stress and distress, and this has been ranked as really the top contributor to optimal functioning among medical practitioners and therapists. And so to improve self-awareness, we can practice mindfulness. Mindfulness really provides training in noticing what's happening, noticing what thoughts are present, noticing what emotions are here. And what research has shown, there was a study that looked at an 8-week mindfulness meditation training with physicians, and it led to improved mindfulness, so improved mindful awareness, improved burnout symptoms, improved mood, and improved mood stability as well, and also improved conscientiousness. So much of what you learn about today with the MBCT protocol as it applies to pain, we can use these same techniques to, again, help optimize our own performance, functioning, and mental and emotional well-being. So moving on then to focus on the protocol. So as Angie described, I have just recently published a book with Wiley, Mindfulness-Based Cognitive Therapy for Chronic Pain. And this book, really the intention was so that I could get the manual and the treatment out there to more people. So this book includes a therapist manual, patient handouts that can be downloaded, as well as all of the guided meditations as well. So anything that I talk about here, if you wanted more information, that book certainly has it as well. So in terms of the treatment structure, MBCT is typically group delivered. I've successfully delivered this protocol with a number of individual clients as well, and so that works really well as too. You modify the structure a little bit for individual therapy, but generally I prefer a group setting, as really the group dynamics themselves become an agent for change, and people learn from each other, people motivate each other, and it tends to work better in my view. There is manualized treatment. It typically consists of 8 2-hour in-person sessions. I've also delivered a 4-session version, and I'll focus on the 8-session version today because it is the more typical, but the 4-session approach is also an option, and a manual for that is also available in my book. Even though here I'm saying in-person sessions, that's typical, but research has shown that you can effectively deliver this over the internet as well. So it'll be interesting to see as more research comes out looking at those different modes of delivery too. And so the treatment also involves at-home daily practices, so guided mindfulness meditation practices, as well as brief cognitive and behavioral therapy exercises as well. And so the importance of the at-home practice really can't be overstated. It's really the heart of the program, and it's definitely key. So, what I tell the people that I work with is really what you put into the program is what you will get out of the program. So for homework, or if you don't like that word, at-home practice, we do encourage people to practice mindfulness each day. And the recommendation is 45 minutes per day. We don't have great evidence currently in terms of dose response. how much meditation is enough for a given person. So even though the recommendation is 45 minutes, I also give the people that I work with a 20-minute version of the guided mindfulness practices, so that at least they can have some sense of accomplishment, and then we work with them during the program to build up to that 45 minutes a day. Also includes brief cognitive and behavioral exercises, so monitoring stressful and pleasant events, and I'll go over in more detail some of those exercises today as well. There's also some reading materials and handouts to provide people with more information on the practices and techniques and the concepts taught during the program. And so then moving into the protocol itself, so starting with the first half of the program. So in session 1, we teach sort of a version of the gate control or the neuromatrix model of pain. And this is sort of a psychoeducation piece to the program that really provides the rationale for why psychosocial treatments are effective for real pain. And so provide the rationale interactively, and describe how thoughts, emotions, feeling centers are all closely interconnected to the pain processing systems of the brain, and that we can actually manage pain by managing these other systems as well, so we can dampen down how much pain is processed in the brain. In session 1, we also introduce the concept of automatic pilot. And so this is really the idea that for much of our days, we tend to just do things automatically and habitually without really noticing what it is that we're doing from one moment to the next. And one of the ways that we experientially teach automatic pilot is to take one of the most basic things we do on a day-to-day basis and really slow it down. So that's what the raisin exercise is. So it's eating just one raisin mindfully, exploring the texture, the color, the light reflections, slowing down the process of chewing and tasting the raisin. And this also illustrates the point that there's nothing mystical or magical about mindfulness. It is just simply paying attention on purpose in the present moment. And when we do this raisin exercises, you really learn, again, experientially, that when we bring that quality of attention to the present moment, it really changes the quality of our experience. And so then building from that informal mindfulness exercise with the raisin, we transition to a body scan meditation, which is the first formal meditation taught. And this is really a stabilizing meditation. So we bring attention to each part of the body in turn. And so that's the practice that is also assigned for homework between session 1 and session 2. And also in session 1, we teach the 3-minute breathing space, which is a really brief, portable meditation technique that you can use on the go throughout the day. One of my patients called it his mindfulness pit stop, where he could top up on mindfulness throughout the day. And so we encourage people to practice this brief meditation 3 times on a scheduled basis throughout the day. So it's quite structured, and it's being referred to as really the backbone of MBCT, and it's taught as a part of all future sessions as well. So in session 2, we once more teach and practice the body scan. We also do a guided inquiry in terms of people's at-home practice, so a homework review. And this is also a part of all subsequent sessions as well. Then we do more of a cognitive behavioral type exercise, so exploring the thoughts and feelings connection. So we give a scenario for example, that you receive an invitation to attend a party that will be held at a restaurant this Thursday evening. And as you're imagining the scenario, what thoughts have been going through your mind, what feelings and bodily sensations. And then we explore how, all of these thoughts are happening. We're interpreting the event and how those interpretations then feed into how we think about the event, how we feel about going to the event, what we're worried about. And then that segues into a discussion of the stress-pain appraisal connection. So how stress and pain are closely interrelated, and how when we have increased stress, this actually increases our pain. And also when we have pain, that also increases stress. So it becomes a vicious cycle, and how within that, really again, our appraisals or our thoughts or judgments about what is happening to us much more important than what actually is happening to us. And so that again links into that ABC model as well, where we have, an activating or an antecedent, an event, and we have C, the consequence, and we're often not aware of that intervening belief that links the two and determines how we feel. Finally, in session 2, we also teach awareness of pleasant events. Even though we've talked a lot about stress in this session, to again sort of reset, there's so many pleasant things that actually happen in our life as well that go overlooked or unnoticed. Because we are, got the blinders on and we're focused on what we're stressed about or the pain, that we don't notice things that might actually bring a smile to our face or some enjoyment as well. And so part of the take-home activity from session 2 is actually to sort of keep a record of just little events even throughout the day that are pleasant, bring a wistful smile to your face. And then noticing the connection between when we have a pleasant experience and we notice that, how does our body feel? What emotions are present? What thoughts go through our mind? And so in that way, again, this is teaching awareness of how, our thoughts, how we're thinking about things really has a big impact on how we feel and how our body feels and how our pain feels as well. So then in session 3, we start off session 3 with a mindful seeing or hearing exercise. And if you have a window present in the room, you can do a mindful seeing exercise where you look out the room, out the window, and really notice what's outside the window, paying attention to the reflection of light, movement, colors. And if you don't have a window, you can do the same thing with a hearing practice as well. So really paying attention to sounds that are present in the room. And then we transition in session 3 to the first seated meditation practice, so mindfulness of the breath and body. And even though this is typically a seated meditation, there's nothing special about the posture here if you're uncomfortable. So a lot of the people I work with have low back pain issues, and sitting really flares up their pain. So some of them do this practice standing up. Others do this practice lying down. The body scan is often practiced lying down in corpse pose. But again, comfort is more important than having a sitting in a really dignified meditation posture. And so the mindfulness of breath and body transitions to less tangible meditation focus than the body scan. And so it's introducing this breath awareness as well as the body. And then also in session 3, we do an exercise to cultivate awareness of stressful events. And if you deliver cognitive behavioral therapy or you've gone through a cognitive behavioral therapy program before, this exercise will be quite familiar to you. So this is similar to a column technique exercise where you notice each day some event that's stressful. If you don't have a lot of stress in your life, perhaps it's just a daily hassle that you see as problematic in some way, shape, or form. And then again, noticing the connection there between that event that might happen. Let's say if it's a traffic jam, for example, what thoughts are going through your mind during that event? How does your body feel? What's the physiological response to that? What emotions are present? And then what are your thoughts afterwards when you're recalling this event as well? And so then in session 4, transitioning to awareness also of sounds and thoughts. So again, the object of meditation becomes increasingly less tangible as the program progresses. So awareness of thoughts in a sense of open monitoring, noticing what thoughts come up, when they come up, how long they last as they pass through the mind. Also in session 4, we have an unhelpful habits of mind handout that we go through as well. This is similar in CBT to a negative thinking handout where basically we're going through categories of unhelpful thoughts. So again, things like catastrophizing, mind reading, fortune telling. And again, the idea here though is not to change these patterns per se, but just to notice when we are doing that, notice when we might be fortune telling, for example, and then to bring that back and come back to the present moment. In session 4 also, we teach a mindful movement practice, and a difference here to an MBSR or MBCT for depression, for example, is that in the mindful movement exercises taught in this program, they're very basic movements. Because it's chronic pain, there might be vulnerabilities in certain muscle groups, so we don't teach yoga. But we teach slowing down everyday movements and noticing the contrast and the relaxation when it takes from raising your arm from beside you to out in front of your chest and holding it there and noticing those changing patterns of physical sensations throughout the body as you do that, and then as you release the arm back down. So that's one example of the movements that we do, the mindful movements. We also teach mindful walking. Again, usually when we walk to get somewhere. We don't walk and be in touch with our body, be in touch with the movement, for example, be in touch with the changing pattern of weight bearing as the weight empties out of one leg, drains out of one leg into the other as you transition with each step. And so with mindful walking, again, we're taking something that we typically do habitually and slowing it down and inserting in this quality of mindfulness. So that's the first half of the MBCT program. The second half of the program with session 5 starts with a sitting in silence practice. And so in this practice, we just simply bring awareness to our breath. When thinking comes up, it's no problem at all. We just label that as thinking, and then we just guide our attention back to the breath time and time again with an attitude of kindness and non-judgment towards ourselves. And so also in session 5, we have steps towards increasing acceptance of the pain and other aspects of our life. And we work with here as well our intermediate and core beliefs as well. So our ideas of how others, the world should be, ought to be, must be, and also beliefs about our own worth, capability, and lovability, and how that really influences the types of thoughts we have and how we respond or react to the circumstances of our life. And then we teach the meditation practice in session 5 is awareness of the breath, body, sounds and thoughts, so similar to session 4. But the difference here in session 5 is that we also welcome in a difficulty into the workbench of the mind within meditation. So we encourage people to start with a light difficulty, so not the biggest problem in your life, but start with something small. You know, I joke that it could even be that you're not able to get a good cup of coffee, you know, something small that's workable so that so you can build skill with the technique of working with difficulties through the meditation practice. You know, and then over time, as we build this capacity, we can work with increasingly more difficult or more challenging experiences as well. And so session 6, we again practice this technique. It's a particularly relevant technique to bring difficulties into the meditation practice and learn how to work with them, especially with the population of chronic pain, where chronic pain is by definition a problem that's constant, essentially nearly every day. Also in session 6, we do a mood, thought and alternative viewpoint exercise. So up until session 6, the emphasis has really been on how our thoughts are really the precursor or determine our moods, how we feel. In this exercise, we actually look at the flip side as well, where we look at where our moods and how we feel coming into events also then clouds and influences the types of thoughts that we have, which then, of course, then turn back around and loop back around to influence our moods and how we feel. So it's, again, just looking at some other angles and how our interpretations can be influenced by how we feel. And then because we are transitioning towards the end of the program, we're starting to look at, you know, what are risk factors or red flags for relapse or for a rising stress and pain thermostat, as we call it. So, you know, maybe it's things like overworking, sleeping too much, not sleeping, maybe it's eating patterns that might be your red flag, but each of us has you know, our own individual characteristics that are early warning signals that we might be starting to become stressed or that pain might be flaring up. And then we start talking about maintenance plans as well. You know, how do we keep up the momentum going forward after the formal program concludes? And so a big part of maintenance in this approach is really personalizing the meditation practices. So up until this point, the homework that people engage in or the at-home practices has been quite prescribed. So, so we encourage people to do certain practices on this day and then alternative day, changing it up. Now, at this point in session 6, the participant or the patient or client becomes firmly in the driver's seat, and they themselves choose which practices are most suitable to them. So then in session 7, we once more practice the meditation where we bring in difficulties into the workbench of the mind to again learn how to stay open to difficulties, breathe with them, ventilate them, accept them, and work with them. And then also in session 7, we explore the links between activity and mood. This is quite a valuable exercise for all of us to do, actually. So in this exercise, basically what you do is you write down a list of how you're spending the moments of your day. So from the moment you wake up, in as much detail as possible, you wake up, you might wash your face, you might make a cup of coffee, whatever it is, you just list it all out for a typical day. And then once you have made a list of how it is that you're spending your day, you break those activities down into of all of those things, you put an N or N next to those activities that are nourishing, and a D next to those activities that are depleting. And you can leave the neutral ones. And then you basically look at what's the balance of nourishment versus depleting activities in my day, recognizing that how we spend those moments is how we spend our days, is how we spend, our weeks, our months, our entire lives. So if we're hoping to shift that balance, it really starts with how can I schedule in more of these nourishing activities, of those activities that are depleting, recognizing that we can't just get rid of them. We have to do certain things in our day. How can I change the quality of how I'm approaching those activities? So, at least make them neutral so they're not depleting me and zapping my energy and resources. And so then building from that, we also talk about relapse prevention in session 7. So how do we again schedule in some of these nourishing activities and deal with red flags when they might come up, red flags that our stress is getting the better of us. And then finally, in session 8, we return back to the body scan. And the idea here is that even though the program is ending, this is much more a beginning than an ending. And so we come back right back around full circle, and we come back to the body scan practice. We also talk about in session 8, getting the details down on the relapse prevention plans, discussing that, doing a brief course review, and providing a mindfulness knapsack handout, which basically is a little handout that has portable techniques, that you can carry around in your knapsack. When you wake up, take 5 mindful breaths during the day, for example. When you take a sip of water during the day, slowing down that process and making that a moment of mindfulness as well. And then we finish the program with a concluding meditation where we do a meditation practice. We give the participants or the clients, a shell or an object of some kind, perhaps a stone, and then that object is linked to their reason, their personal reason for keeping up the practices, and becomes a reminder of the program, who they've shared these experiences with, and to keep on the journey that they've started here as well. So that's really the nuts and bolts of the MBCT program. And what I thought, to give you sort of an experiential sense of how one of these programs feels like, I thought we would actually practice a 3-minute breathing space. Since this is the backbone of the program, and it really is brief and portable and is a way to reset, I thought we would just go over this practice. Just to give you an overview, there's 3 basic steps. So the first is awareness, so noticing what thoughts, emotions, and feelings are present. Then I'll guide you to anchor your attention, so gathering your attention on the movements of the breath, and then expanding that outwards to the whole of your experience. So if you don't want to do this practice, completely fine, but if you would like to give it a go, first off, it helps to actually change your posture. So since it is a brief practice, to take on a dignified sitting posture to sort of signal to your brain that you're switching out of automatic pilot and into mindfulness. So you can do this standing or sitting, but having your feet flat on the floor and your legs uncrossed, and allowing your back to be straight but not stiff, and the crown of your head to reach up towards the ceiling and your chin to lower slightly. And if it's comfortable for you, just letting your eyes close gently. And just taking a few moments to notice what your experience is right here, right now. Noticing what physical sensations are present. Noticing what emotions might be here. what thoughts might be going through your mind. And now, having taken stock of your experience to whatever degree you have, gathering your attention and anchoring it firmly on the movements of your breath. And just resting your attention wherever you feel the movements of the breath most strongly for you, whether it be at the nostrils, back of the throat, chest, abdomen, rising on the in-breath and falling back towards the spine on the out-breath. There's no need to control the breath in any way, just simply letting the breath breathe itself. Aware as you breathe in and as you breathe out. Just gently riding the waves of the breath. And now, having anchored yourself to the present moment, again, to whatever degree you have, allowing your awareness to expand back outwards, to also include a sense of the body as a whole, sitting here in this moment, breathing. Holding all this in an open, slightly softer and more spacious awareness, and yet still present. Nothing to do, nothing to fix, no state to be achieved, just this. Knowing that this moment is all we have, and tuning into it is as close as the next breath, this breath. And so now, as you're ready, just bringing your awareness back to the room, perhaps wriggling your fingers and toes, and as it's comfortable for you, just letting your eyes open. And so if I were teaching this practice in a session, we would be following that practice with a guided inquiry, as we do with all of the meditations taught in session, and exploring your responses to that practice, what came up in the meditation, and also connecting it back to how this relates to living with chronic pain. And so this really is a portable, brief practice that does allow us to, in some ways, reset during the day as well. And so if you would like to explore practicing mindfulness more for your own self-care, there are guided audios in my book with the companion website. It's also freely available guided audios through the UCSD Center for Mindfulness, the UCLA Mindful Awareness Research Center. There's also a number of apps that have freely access to downloadable meditations as well. So we're fortunate at the present point in time that there's lots of resources out there and available to us. So switching gears to just give a brief overview of some of the research that is now supporting MBCT for chronic pain. So I'll describe in brief this study that I conducted, the efficacy of mindfulness-based cognitive therapy for headache pain, that I did with Professor Beverly Thorne. And this was one of the first pilot studies looking at MBCT for pain. It was a randomized controlled trial. Because it was the first, one of the first tests of MBCT, we compared it to a waitlist control condition. And the sample was a primary headache pain sample, so mostly migraine and tension type headache, and quite a small trial, so 36 people. The primary outcome was pain-related variables, and the secondary outcome was cognitive variables. And just a brief overview of the results. So we had large effect size improvements for pain intensity, large and significant improvements for pain interference, pain catastrophizing, pain acceptance, as well as self-efficacy. So from this pilot study, we could really conclude that yes, MBCT for pain is feasible, and the results are really promising across a range of pain and well-being related outcomes. Other studies have emerged that have found very similar results, and so most of these studies have compared MBCT to relatively inert control conditions. The study by Dowd included a psychoeducation comparison condition, and that was an online delivery as well, which was particularly innovative. So there's more and more research building. In my lab here, we have just finished the treatment delivery phase of another randomized controlled trial of MBCT for low back pain. And so this study was supported by the Australian government. And this is a comparative trial, so again, a randomized controlled trial. And this study is comparing cognitive therapy, so building from Dr. Beverly Thorne's Cognitive Therapy for Chronic Pain, the first edition, because this trial included just pure cognitive restructuring techniques without any relaxation practices. It was a 3-arm trial, so the second condition was mindfulness meditation, and then the third condition was mindfulness-based cognitive therapy, which was built off my book, published with Wiley there. So the sample was low back pain. The intent to treat sample size was 69. And the primary outcome for this study was pain interference. Secondary outcome was pain intensity and other function-related outcomes. But just to give you a preliminary take on the results of this study, like I said, treatment delivery just finished up in December, so we're only just now able to open the data and look at it. But you can see significant time effect. So all 3 treatments improved quite comparably in terms of pain interference. There was not a significant difference between conditions, which is what we expected. And so basically this shows that MBCT is equally as effective as other treatment conditions. And you can see on the right up there that there was large effect size improvements in pain interference for mindfulness meditation and mindfulness-based cognitive therapy, and medium effect size improvements in terms of change from pre to post treatment in cognitive therapy. Similar outcomes for the secondary outcome, pain intensity, so significant time effect. So all 3 treatments significantly improved pain intensity, but there was not a significant difference between the conditions. And you can see there on the right that MBCT resulted in a medium effect size, and the other conditions small effect size. So again, quite similar in efficacy, but again also shows that MBCT is a viable and potentially quite efficacious treatment option for low back pain as well. So finally, just touching on the current mechanism evidence, a simplified model is that mindfulness-based cognitive therapy with the integration of CBT and MBSR targets both cognitive content, so what people think, their pain control beliefs, as well as cognitive processes, so that's how people think, so mindfulness and acceptance, for example. And the changes in both cognitive content and process are theorized to be primary pathways through which we see these improvements in pain and stress outcomes in MBCT. If you would like a more complex overview, my collaborators and I recently published a review and theoretical model in the Journal of Pain. That was in 2014. And you can see that there's brain state mechanisms, so changes in attentional control and decoupling of attention from emotion, changes in cognitive content, process, emotion, and affect. Like I said, it's quite a complex picture, so you can certainly read that article if you would like some more information. An exciting other direction is we're starting to get research looking at the effects of mindfulness meditation on neuromodulation, so changing the way the brain is processing the pain. Most of these studies have been done with healthy samples, so training healthy individuals in mindfulness meditation and then doing an experimental pain manipulation to see how their brains may be processing that pain differently. And so research has shown that mindfulness leads to increases in grey matter in the brain, which has been associated with improved pain outcomes. Also decreased activation in the smarter sensory cortices, which again reduces pain processing and improves pain intensity. And also changes observed through EEG brainwave activity, so increased power in both alpha and theta. And so that's associated with decreased anxiety, increased calm, positive affect. The differences in theta activity correspond to heightened attention with mindfulness training and reduced stress response as well. So there's a lot of possibilities in terms of the processes through which mindfulness may improve pain outcomes, and certainly the changes in brain structure and functioning are particularly exciting, and it is a needed future direction to explore in more detail. So just in conclusion, MBCT really is based on a rich theoretical condition, and the theory is continually evolving and being sharpened. The evidence shows that there's a high possibility that MBCT is going to be a very effective treatment for chronic pain. Certainly the evidence to date is very promising and large effect sizes have been shown. It's also, mindfulness is also useful for yourself to prevent burnout and perform optimally, enhance mental health and quality of life as well. Yeah, and really in the last several decades, great strides have been made. Diagnostic criteria have been clarified, new medications have been developed, psychosocial interventions have been successfully applied. Despite all these advances, though, many people continue to endure unremitting, disabling chronic pain. And so that tells me that we do still have more work to do to improve our management of chronic pain conditions. So I'd like to just acknowledge my collaborators. I'm so fortunate to work with wonderful people, and we've also been fortunate to receive funding for much of our research, which makes it possible. So thank you for your attention, and I'd be happy to answer any questions that you might have.
Thank you. And to our audience, if you have any questions at this time, please enter them into the question box on the GoToWebinar panel, and we'll read them out loud. A few questions that came in. Can you provide a link to where we can find your book?
Oh, easily. Yeah, definitely can do that. Mm-hmm.
Okay, we can include that in our follow-up materials to the audience.
Mm-hmm. No problems.
Another question, can you talk a little bit more about the homework review and how that consists as part of the sessions?
Mm-hmm, mm-hmm. Yes, so the homework review is a part of all sessions starting from session 2. And really that is explored through what's called a guided inquiry. And my book does give you more information on how to conduct one of those guided inquiries, but it starts off with really just an open question, how was your at-home practice this past week, and exploring their experiences. And here is where it's particularly critical that the therapist or the person leading these groups embodies and models the qualities of mindfulness. So here, we're not trying to problem solve for the patient. We're really trying to openly explore and to notice their reactions to the homework. If they feel like they did it right or they feel like they did it wrong, exploring all of that, because of course there is no right or wrong way to practice meditation. And so we discuss those experiences and, like I said, do talk about any challenges that have come up and how participants are relating to that. Of course, a common one is, not being able to find the time. And so exploring what that means, exploring what they attempted to do. So it really is an open discussion of their experiences during the week. And in that guided inquiry too, since this is being delivered for pain management it is particularly important to come back and link this back to how do these practices relate to managing chronic pain. And so you ask that question openly as well, so that people begin to make their own connections between what they're practicing and how that might help them improve their pain and their pain management.
Mm-hmm. Another question that came in, do you think some clients might be better suited to cognitive therapy or to MBCT? And if so, is there a standard screen to identify which treatment they might benefit from?
Mm-hmm. That's an excellent question, and I think it is a necessary future direction, because I certainly think that some people are more or less suited to different approaches than the other. And really the way we go about this is our evidence-based practice guidelines. A client comes through the door, they have this symptom presentation. We know that this treatment, treatment X, treatment Y, both work for this. We talk with the patient about the options and see what are their preferences as well. Currently, we did actually recently publish a review of the moderators of psychosocial treatments and trying to match people to the treatment most likely to be of benefit on the basis of their baseline profiles. And while that's a preliminary model, it does give some ideas, so I'd be happy to email the title of that paper as well. My collaborators and I, we are using research to look at baseline brain state, EEG, as predictors of response to. Alpha differences at baseline have been shown to predict response to mindfulness meditation, for example. So I think this is a particularly exciting area that we're going to definitely need to improve so that we can optimize resources and also optimize efficient outcomes for people undertaking these programs as well.
Mm-hmm. And last question, there is a request for the 2014 article that you referred to.
Oh yes, I can definitely send it. That was the mindfulness theory model as well. Yes, I can send that to you as well.
Okay, I think that is all for questions in the session. Dr. Day, is there anything you'd like to add following your presentation?
No, thank you for inviting me to be a part of this webinar series. I think it's going to be a wonderful resource for people that's available through you, and I hope that this was helpful.
Thank you, and thank you so much for your presentation.